Hey, it's your old pal, Dr. Steve, and welcome to the SARS-CoV-2 COVID-19 Updated Situation Report for August 23rd, 2020. This is the 16th in a series. Previous episodes are available and have general information about the current pandemic, antivirals, vaccines, and basic science that are not covered on a weekly basis, so check those out. All right, let's get started with the current statistics that we're following. The world's up to 22.9 million cases. USA at 5.67 million cases, which is about 1.7% of the population. Now, that doesn't necessarily mean that only 1.7% of the population has been infected. These are cases. Obviously, people who are asymptomatic, who have never been tested, won't show up in these numbers. Brazil coming in at number 2 at 3.5 million, and India at 3 million, and Russia coming in at 4th place at 949,000 patients. New daily deaths in the United States, it seems to have leveled off significantly. We'd like to see that start to decline, of course. And new daily cases in the United States are certainly declining, so we would expect deaths to follow. Usually that trend will follow anywhere from 2 weeks to 6 weeks. So, you make a movement in one domain, and it takes some significant amount of time to see movement in the other domain. Now, here was the R sub T 8 weeks ago. Remember, the R sub T is the average number of people who become infected by an infectious person using real-life data. So if the R sub T equals 1, there's a linear increase in total cases. Think of it this way. 100 people would infect 100 people because it's one person's infecting one person. And therefore, that 100 will infect another 100, will infect another 100. So you'll have a linear increase. When R sub T is less than 1, the virus will eventually stop spreading. So if the R sub T is 0.9, which our goal is to get that R sub T below 1, then 100 people would infect 90 people, which would infect 81 people and 72, etc. Okay? And when it's greater than 1, rapid spread occurs. If you have an R sub T of 2, for example, 100 people will infect 200, which will infect 400, which will infect 800, and then 1,632, etc. And that's that curve that you see when we have geometric spread. Well, here's our R sub T today. So you can look, more than half the states have an R sub T of less than 1. So we'll give them one of these. Nice job. We still have a ways to go, but if we can get the whole country with an R sub T of less than 1, then this thing will fade away on its own without any other intervention. But to do that, we have to continue with our mitigation techniques that we're employing right now. As far as new cases, the states with the highest number of new cases are California, Florida, Texas, Georgia, Illinois, North Kakalaki, Michigan, and Missouri. Tennessee is in there, and Virginia and Ohio as well. California today had 5,535 new cases. But you can see that the new cases in California have leveled off. And maybe even if you look at the last 10 days, there may be a slight trend slightly downward, so that's good news. New deaths, however, are continuing to increase, but remember, those will lag anywhere from 14 days to 55 days behind any decrease in the new cases. States with 0 new deaths: Connecticut, Delaware, Kansas, Louisiana. Remember, Louisiana was a hot spot at one point. Nebraska, Rhode Island, Vermont, and Wyoming. Also the territories of Samoa, Guam, Virgin Islands, and the North Marianas Islands. Excellent. We'll give them one of these as well. Maybe a little of the old Opster.
Give yourself a bill.
All right, let's get into news. We have a new test. The FDA issues an emergency use authorization to Yale School of Public Health for a new test called Saliva Direct, which uses a new method of saliva sample processing. The great thing is you can do any saliva sample in any sterile container. It doesn't require any new equipment, and it doesn't require separate nucleic acid extraction. So the rate limiting step, if you ever took chemistry, you know that the slowest step or the bottleneck is the thing that's going to determine how long a chemical reaction takes. Same thing is true in human systems. And even if we had tons of machines just sitting there ready, if you didn't have extraction kits, you couldn't do tests. So we had plenty of tests, but no extraction kits. So, go figure. So this will eliminate that problem. So Yale is providing the protocol as an open source to other labs. Good for them. It can be assembled and used in all kinds of diverse, advanced science labs across the country and the world. So that's a good news. So this is anything that improves our access to testing is a good thing. And if this catches on, no more stupid swab up the nose. There is a drug that is looking to compete with favipiravir. It's one that was initially designed to combat influenza, similar to favipiravir. There's a phase 3 trial that's starting in September, and it's an oral drug. And like favipiravir, which we're still waiting on some good phase 3 data, we've got some preliminary data that looked encouraging. But this is an oral drug, and if it's effective, we would use it early in the disease to try to prevent people from progressing from mild disease to severe or critical disease. So if it keeps people out of the hospital, and it keeps people who are in the hospital from going on the ventilator, and if it keeps people who are on the ventilator from dying, then we can, if it's effective enough, we may be able to open back up a lot sooner than we thought, even before we get to a vaccine situation or herd immunity. And then there's a really interesting one, is this recombinant ACE-2. So if you remember, the coronavirus spike protein attaches to this receptor in the body called ACE-2. So what some geniuses came up with was, let's just throw out some decoys. And they're using fake ACE-2 receptors, and the virus attaches to them, but then they can't invade the cell because there's no cell there. So you know what? Suck it, COVID-19. All right. Ivermectin is in the news. I thought I'd cover a couple of things that were sort of running through social media recently. Ivermectin is one of those. It is an antiparasitic. It's not a classical antiviral, but it does have some antiviral activity, and it definitely blocks coronavirus, but in cell cultures. So this is in the test tube. And remember, we've talked, if you listen to my show, Weird Medicine on the Laugh Button or on SiriusXM, you'll know that things that do things in cell culture don't always do them in the human body. And the dosage that they use to block coronavirus in cell cultures would have been toxic to humans. Now, there are 33 clinical trials that have been launched. One is a nasal spray. Another one is intravenous use, and a diverse bunch of studies. There's 0 randomized controlled trial in humans so far. If you have ivermectin at home and you get COVID-19, please don't take this drug. None of the protocols have been established. It's not been established to be safe in COVID-19 cases yet, but it is being studied. So we hope to have data on it soon. In addition, the big one that's been in the news lately has been Oleandrin. This has potent antiviral activity in vitro, and yes, the oleander plant that it comes from is toxic. There's lots of medications that come from things that are toxic. That's not the real issue if it's prepared properly and in the right doses. Lots of things that are toxic in their natural form can be used as medications. But there was a study, and I've given you the reference below. This was in vitro study again. But they did recommend that it was potent enough that it should be tested in animal models and humans exposed to infection to determine its medical usefulness in controlling the pandemic. So I went on clinicaltrials.gov to see how many studies there were. There's 33 for ivermectin, only one. And it's a 100-patient feasibility study which is underway. It should be completed in September. It is not being done in some, somebody's backyard. This is being done at Texas A&M, Baylor, University of Maryland, etc. So this is a real feasibility study. This is a so-called phase 1 study to see if studying it further is feasible and if the drug is so toxic that they can't continue. That's what phase 1 trials are for. You only expose a few people to them, anywhere between 40 and 100. Then they'll do a phase 2 to see if it's effective, which may be up to 300 people. And then if that proves safe and effective, then they'll do a phase 3 trial with 1,000 to 30,000 people. And if that's also effective, then you'll hear about it here first. Well, probably not. You'll hear it on the news first, but I will go over the whatever studies that they get from that. So this is an interesting molecule. I can't recommend that you take it because there's no data that says that it's effective in human beings. So let's let the science do its thing, but they are studying it. All right, so in the meantime, stay healthy, be smart. Physical distancing is still important, hand washing, and wearing a cloth face covering or face mask. I know it's controversial, but look at it this way. You saw the R sub T's, they're all very close to 1. If we can reduce transmission by even 10% using face masks, they say 90% of the time it doesn't work. I mean, just speaking hypothetically, will you give me that it'll work one time in 10? That will get almost all of those states below 1 as far as their R sub T is concerned. And we will see declines in cases, deaths, and hospitalizations. So I still feel that, particularly in areas where it's endemic and you can't safely social distance from other people, wearing a face mask is important. Don't lose hope. There is light at the end of the tunnel. Check out our Twitter, @WeirdMedicine. Go to our podcast at thelaughbutton.com/podcast or anywhere where you get podcasts. Listen to our show on SiriusXM on the Faction Talk channel. Best way to do that is on demand. And until next time, thanks for watching. We'll see you in a week or two for the next Weird Medicine COVID-19 situation report. Take care, everybody.